Hi everyone. In this video, I am going to talk about the neurological condition called Pseudobulbar Palsy. It is a condition resulted from bilateral degeneration of the cortical bulbar pathways of the upper motor nuclei. The degeneration can be caused by conditions such as demyelination, bilateral cortical bulbar lesions, Parkinson's disease, ALS, and other neurodegenerative diseases. So patients of pseudobulbar palsy have difficulty chewing, difficulty swallowing, which is a condition such as dysphagia, and they demonstrate slurred speech such as dysarthria. So basically, restricting pseudobulbar palsy is restricting the proper functioning of the muscles around the facial area and the tongue movement due to muscle weakness. Also, people with pseudobulbar palsy can also demonstrate inappropriate emotional outbursts, such as laughing out at a serious question. And this is due to the disinhibition of the motor neurons controlling laughter and crying, and the disinhibition of a reciprocal pathway that exists between the cerebellum and the brainstem that adjusts laughter and crying responses, making them appropriate to context. So, people with pseudobulbar palsy are inhibited with these mechanisms. In order to diagnose for the pseudobulbar palsy condition, other than detecting muscle weakness and the speech ability, other methods are also involved, such as gag reflex, knee-jerk reflex, because they are usually increased in patients with pseudobulbar palsy. Also, to more accurately diagnose the condition or to further confirm the condition, functional MRI can also be performed to detect any damages and abnormalities in the brain. There are many general symptoms, signs, and conditions that occur in every case of pseudobulbar palsy, such as dysarthria and limitation of the tongue movement, and drooling. However, there are different types of pseudobulbar palsy conditions that occur with each and different brain disorders, such as, for example, bilateral Parkinsovian oliguria, showing symptoms of dysarthria, limitations of tongue movement, drooling, and poor lingual and labial consonant. Generally, there are no medical treatment for pseudobulbar palsy conditions, but in this particular brain disorder case, in this particular research case study, surgical resection of the damaged brain areas were performed on these patients, and they did show improvement of from the pseudobulbar palsy conditions. So, therefore, that was a very kind of a breakthrough for pseudobulbar palsy, and also an unusual disease that caused the pseudobulbar palsy is the human African trypanosomiasis, and it is a sleeping disease that is parasitic tropical disease endemic to sub-Saharan Africa. This disease sometimes invades the central nervous system, thus developing conditions of the pseudobulbar palsy. Due to the paralysis of the muscle innervated by the medulla, they may have symptoms and conditions such as a restriction of neck movement and poor respiratory reserve, causing intermittent panting. Also, another disease that may cause pseudobulbar palsy is called herpes simplex virus encephalitis in AIDS. So this disease, they cause symptoms such as being speech fluent, but with jargon dysphagia. And also they severely impair comprehension with no insight in the patients. So in this case study, those patients were treated with 3 weeks of intravenous aciclovir therapy and 3 days of dexamethasone. The confusion subsided and the pseudobulbar palsy resolved completely after this therapy. So thereafter, the patients recovered to normal speech, strong gag reflex, and resumed eating and drinking. And this was a very important case study and on these patients because that before this study, resolving of pseudobulbar palsy had never been reported. So therefore, intravenous aciclovir therapy and dexamethasone could be a potential treatment for pseudobulbar palsy in the future. There are also many other brain disorders that may cause pseudobulbar palsy that I am not going to list every one of them now. But as of treatment for this condition, currently there are not any definite and specific treatment, as it is an occurring condition or a side effect of other brain disorders. Therefore, treating for that specific brain disease may eventually resolve the symptoms of pseudobulbar palsy. But aside from that, research possible pharmacological interventions for pseudobulbar palsy include the tricyclic antidepressants, serotonin reuptake inhibitors, and a novel approach utilizing dextromethorphan and quinidine sulfate. Dextromethorphan works to inhibit the glutamatergic transmission in the regions of the brainstem and cerebellum, which are hypothesized to be involved in pseudobulbar palsy symptoms. So dextromethorphan acts as a sigma ligand, binding to the sigma-1 receptors that mediate the emotional motor expression. So overall, that is all we know about pseudobulbar palsy currently, and there are many ongoing research in terms of bettering understanding of this condition, also finding curable and reliable treatment for it. So that is all I have to talk about today. Thank you.